let's talk a little bit about the information surrounding COVID these days. It seems like everyone is now an expert or having an opinion. I've seen people sharing misleading or conflicting information online about treatments, actions, and causes. And this can lead to panic and fear that could be dangerous and slow down the progression of fighting the coronavirus. Today with me, I have Dr. ZAGURY on a video call. He is a member of the board of directors of the UFE Health Division, and we will be asking for his expertise, and he will be sharing his factual medical analysis that allowed the community here in Shanghai to be reassured and understand the evolution and the ongoing issue during this crisis. Thank you for joining me today, Dr. ZAGURY. Could you please introduce yourself and talk about your expertise?
Sure. So I'm Dr. Guillaume ZAGURY. I've been working as a physician doctor, as I'm qualified in France in emergency, but in China as a GP. I've been the founder team of the second international hospital in Beijing called 𝗘𝗍𝗍, and I was the first CMO, Chief Medical Officer, and then I finished with the position of VP. And that's my experience for hospital upper management. And I'm a specialist as well in international public health. I've been in China since 20 years and experimented the South in 2003. And now recently we experimented with the French community, analysis sharing, daily analysis sharing about the COVID for January 28th. And we have got about 10 WeChat group and 5,000 followers.
Thank you for joining me, Dr. ZAGURY. The first question I want to ask you is, how do people catch the coronavirus, and how long does it typically last? How long does the virus last, and what can we watch out for regarding the virus or catching the virus?
Okay, it's a air respiratory virus, like the flu, in a way.
Right.
And you catch it through the droplet, through your hands, through the skin,
Yes.
and sometimes it can live outside on a table or things like this. But the most common is air drops and hand.
Okay, so it's mainly common through the air, but you can catch it on your hands. So I want to ask a follow-up question regarding disposable gloves. Some people in Europe have started wearing disposable gloves. And what are the risks of wearing disposable gloves, or are they more of a benefit than a hindrance in regards to spreading?
But first point, you can go up to this extremity to wear gloves. But I think the most important is to wash your hands 4 or 5 times daily. It's as good as well.
Yes. So more important to...
It's maybe not as good, but it's okay.
Okay. So more important to wash your hands than to use something like disposable gloves. So it's washing your hands is more important, public hygiene is more important than objects like disposable gloves. So
for me, from my viewpoint, washing hands is simple.
Yes.
It's convenient. I don't think you have to go to this extreme.
Yes, definitely.
You have to wear gloves.
Yes. And what should someone do if they believe they've started to catch the symptoms? So if someone is starting to show signs, what is the immediate step of action?
So the most important is what we call in French 3M. The mask.
Yes.
Okay. In French, M means hands, means washing hands.
Okay.
And the third is the social distance, means 1.5 meters far from anybody, and especially if there is somebody sick, you go away.
Right. And so when someone has shown the full symptoms, they should do these 3Ms. What if they have started to only show some symptoms, or maybe only one symptom? Maybe they've only just started developing a cough. What should someone do in those regards?
Yeah. First point is any common respiratory syndrome can let the doctor think about COVID, but it can be anything. Mainly it's fever, coughing, but now it's going to sometimes diarrhea, and it's and asthenia means you're tired, but sometimes it's nothing. That's why it's complicated, you know.
Yeah.
But the top three symptoms: fever, cough, and lack of energy, and so on, you know.
Yes. And regarding reinfection or recontamination, if someone has had the symptoms and they've started to recover, what is the chance of reinfection or sort of catching
At this
it again?
stage, I get it. You're asking me if it's an immune disease, if the immune system is going to we don't know exactly what's going on. We're saying it should be like the flu, you have antibodies, you know, but we are still studying this, you know, and it's key for China. Because for China, the risk is the second wave. If there is a global immune response, there is no problem. But that's what we are studying this. And first, we need to know what is the level of the population for the immunity. And second, maybe there will be a vaccine by the end of the year or just after.
Okay. And what do you think, from your experience, has been the best way to combat this virus or the spread of the virus?
So, the best way, you have two types of examples. And we have the chance to experiment the two ways. First way, I would say, the prevention, the dam barrier. We don't let the virus invade. That is three things. The self-prevention, that means I wash my hand, I put a mask, that's one point. Second point, I put, can I repeat the question, sorry?
Oh, of course, yes, definitely. So based on your experience, what has been the best way to combat the virus and what protective measures?
So, the best way you have to see the individual level and the collective level, the public health. Individual level, we already see it. It's preventive by yourself. We know what we have to do. Now, in a collective way, there are different tactics, and we have experimented the good tactics and the bad tactics. The good strategy, bad strategy. Good strategy, mainly in Asia, with China, with Korea, with Singapore, Hong Kong, and some in Europe, like Germany, okay? But it's a strategy. We don't let the virus enter, okay? So, personal and collective. Collective means lockdown, for example. So preventive, individual level, collective level, and third, we have to be offensive. That means we have to get tests. That's the big lesson from Asia Pacific Asia. We don't let a case going by itself and make hundreds of people. I remind you that in the Diamond Princess boat, 20% of the people were infected. That means it's very contagious, okay? And we know it. So we don't let this virus to be contagious. That's the bad way. And the bad way is what we experimented now in Europe, from Italy, France, Spain. They let the virus going all over, and they are passive. The virus is going to make more and more people involved, more and more sick people, and all these people, 5% of them will go in ICU, and the ICU will be full of. So the public health system is not ready to have it's very many to manage 5,000 people. But when it's going to be 20,000, it's not possible to get 20,000 or 50,000 people in the ICU. So the best way, the message is, we come before. We make the barrier before. Personal, collective. Collective means lockdown, washing, and identification of cases. How come? With tests. And when we identify a case, don't let him go back at home. He is blocked in in a place where we can control. 1 point. Second point as well. When we identify a case, we look all over his contact people, and then we focus on them to isolate them and don't let them contaminate everybody.
Okay, and Doctor, you've mentioned regarding the healthcare system. I wanted to ask you, how do you think this will impact the global healthcare system after the virus has subsided? How do you think this will impact the global healthcare system as a whole?
So you're asking me about the test, huh?
Well, about the healthcare industry and how this will affect countries across the world with their healthcare schemes, because this virus has really shown the sort of extent of them.
What we've seen all over the world is two things. The champions for tests were the top three, let's say like this: China, Korea, Germany. And where do you see the best result? Korea, China, Germany at this stage.
Okay.
On the other hand, if you see the people who didn't use the test, Italy, France, Spain, it's a disaster. It's not very well managed. Okay? So we've got two levels, the preventive one and the curative one. Those who have got the test and the mask, they can focus on the preventive one. Those who, for different reasons, they didn't have enough test or mask stocks in the stock on stock, the virus develop, and 2% of the population, weak people, mainly weak people, aging or having a comorbidity, are likely to die.
Okay, Doctor, and you mentioned this term yourself earlier in the interview. Terms like social distancing and self-isolation have become more of the public in the public consciousness. What tips would you recommend for someone to self-isolate or socially distance, and what is the correct procedure, for example, with families and such?
You know, I've got a friend, not a friend, somebody I know. There were 5 in the family, French people. 1 month ago, okay? So the guy was in Paris, he's living in Shanghai, he went back to China, okay? 2 weeks after, there was two people of the family who had died, okay? One was in ICU, and the other one was in observation. That means, from my viewpoint, it's crazy to let people going back at home, and especially if they are sick, if they got positive. This is no way. That's the way. You see in the Navy, in the Croisier, in the Princess Diamond Princess Navy boat, we've seen a lot of family case. So people who are positive, they have to be isolated for 2 weeks. Clear. Those who have in contact, they have to be observed. And strictly observed. That's the best way to prevent. If you don't prevent, it will be the flow of patients will destroy your capacity.
And I assume these cases would be exacerbated by people at risk, so the elderly or those with lower immune systems, or even more recently as well with pregnancies. For example, what steps should a pregnant woman consider when she is nearing delivery and with this virus outbreak?
So at this stage, it's a virus, so it's for sure it's going to go if the woman is positive, likely the baby, the fetus is going to be infected. Okay? After it's case by case, at this stage there is no specific treatment from mine, and they don't know as well if there is a big impact. So it's on study. You know, it's 3 months already. We know so many things, but we don't know everything.
Okay, Doctor. And so for a pregnant woman who does not have the virus yet, but may have to go for a hospital appointment, etc., what precautionary measures should she take? Should she bring a mask? Should she make sure everything is... what measures should she take before heading out to the hospital, if she's not positive already?
Okay, for sure she has to go there. and to get some ultrasound, whatever, she needs to be protected, self-protected. So for sure, she needs to have the mask. She needs to be away from the social distance has to be 1.5 meters, and she has to avoid to shake hands, and that's the common sense.
Okay. And our final question, Doctor. What is your suggestion for everyone around the world right now to start doing or stop doing? What do you recommend people around the world start or stop doing?
In case it's a case-by-case policy. It depends on a lot of things. We know that the target of this virus is all people or those who've got some respiratory disease, high obesity, and so on. Okay, so depends of the age of the population around. Depends of the prevalency, means how many people, how many patients around per 1,000, for example. Okay, depends of the speed of the epidemic and a lot of parameters. So if you see countries like Hong Kong, it's a soft lockdown. Depends on a lot of parameters, but one point is key, is to protect the weak people. These are the key. If they have to be isolated. They have to be isolated from the virus risk. So all the people around has to be no contaminated. So you can be soft lockdown, but you have to be very, very strict with target people. We know them, you know. So it can be like in Hong Kong. They are still working in a way for private sector, but you have to be first. You have to get the prevention, means the mask and so on, and you have to target the good management of potential case, identification of case, and on the other hand, you have to be preventive with the weak people, and that's the key.
Okay. Thank you, Doctor, for answering all my questions. Thank you, Dr. ZAGURY, for helping us with answering the questions regarding the coronavirus. Your website is COVID Minute, correct?
Yes. And sorry for the French accent. I could took a better English or American accent, but
not a problem at all. I'm sure our audience has no problem understanding the advice you've given us. You update the website daily, and it's been running since the mid of January, correct?
Thank you. Yeah.
Yes, perfect. Okay, thank you once again for joining us, and thank you once again for your expert advice on this.
You're welcome. You're welcome. Bye-bye.
I want to thank once again Dr. ZAGURY for coming and answering our questions today. However, I also want to thank all the medical responders out there across the world, nurses, doctors, GPs, anyone who's helping with this crisis, trying to find solutions or just helping those who are sick. It's a very important time and they deserve our utmost respect and admiration. So I want to take a moment to thank everyone who is fighting this virus and trying to keep it at bay. Keep in mind, guys, that you can help as well by staying at home, doing your social distancing, making sure you're washing your hands and following the advice that experts like Dr. ZAGURY have been saying. There is a lot of information going around, but the ones from medical experts are the ones that we should be following. So remember, guys, stay safe and stay home.